And some medical news now. A troubling new report finds more Americans dying of heart disease than any other cause of death. The American Heart Association says that's because risk factors like high blood pressure, obesity, and diabetes continue to rise, and exploding popularity of weight loss drugs like Ozempic has not had an impact, at least so far. Dr. John LaPook stresses that it's important to know your numbers.
Specifically, people need to learn there's something called LDL, that's the bad cholesterol, and lipoprotein A. You should know both of those numbers. And then, of course, we all know about high blood pressure, about diabetes, about exercise, about eating right. And then there's family history. You have to choose your parents wisely, right? There's not much you can do about that.
In the U.S., about 350,000 people die of sudden cardiac arrest every year. About half of them had no idea they had the disease. And keep your Super Bowl spreads safe. The USDA says don't let your food sit out too long. The danger zone is between 40 and 140 degrees. Hot food must stay hot, cold food cold, and nothing should sit out for more than 2 hours. Food safety experts also suggest serving in stages instead of one big spread, and using insulated containers for takeout. They say a food thermometer is your best defense against game day illness. It is an infectious disease caused by a type of bacteria which primarily impacts the lungs, but tuberculosis can spread to other parts of the body too. Right now, Kansas health officials are trying to get a handle on what's being called an unprecedented TB outbreak in that state. Mandy Gaither has the latest case data.
It's the largest outbreak of tuberculosis in the U.S. since monitoring began in the 1950s. A wave of cases has hit Kansas beginning in January of 2024. As of Friday, there have been at least 67 people being treated for confirmed active TB infections. There are 79 other confirmed latent cases where TB is detected in the body but is not making the person sick. 2 deaths linked to this outbreak were also reported last year.
TB is caused by a bacteria that principally involves the lung, and it usually is transmitted person to person with prolonged contact.
The outbreak is still ongoing, so there could be more cases, but the CDC says most U.S. residents are at minimal risk for TB, as the country has some of the lowest TB rates in the world. The Kansas State Health Department hasn't said what caused the outbreak, but experts say people who have a higher risk of TB exposure include those born in or often travel to countries where the disease is common, and those who live in large group settings like homeless shelters, prisons, or jails. People who work in places where TB is more likely to spread, including hospitals, shelters, correctional facilities, and nursing homes, are also at higher risk.
If there are people in those local communities who are concerned and they go out into the public, well, put on your mask. You'll be protected against TB, and you'll also have some protection against flu, which is out there everywhere still.
And along with screening, TB can be prevented with protocols like vaccinations and making sure people who are infected finish their course of treatment. The vaccine is not generally used in the U.S. because of its low TB incidence rate.